Good afternoon, dear chairmen and dear members. This is our experience in Selçuk University Medical Faculty, Turkey. And NAS procedure is described in 1988, the minimally invasive repair of pectus excavatum deformity via video-assisted thoracoscopic surgery. And the Abramson procedure is the 25, the minimally invasive repair of pectus carinatum deformity. In our experience, since 2011, the turning point ravaged the NAS procedure, the open surgery, the NAS procedure. 113 patients with pectus excavatum and carinatum deformity. We performed the postoperative and perioperative evaluations for cardiopulmonary function and the respiratory muscle pressure test. This is the respiratory muscle pressure test, the postoperative effect of NAS procedure and postoperative period also. The continuous clinical follow-up, the 3 and 6 months, the period after operations, and at least 2 years, the bar removal time, our aims. And pectus excavatum, 81 patients, and 65 males and 16 females. 40 were symmetrics and 37 asymmetrics. Associated anomaly of disease, 3 Marfan syndrome, 1 scoliosis, 1 congenital cystic adenomatoid malformations. The mean Heller index is at 3.7. Heller index is higher than 3.25. 37 patients. At age of operations, the about is 16 years old. And postoperative hospital stays the 4.5 days. All pulmonary functions tests were normal, and cardiopulmonary echocardiography is a 7 mitral valve prolapses, 1 Epstein anomaly, 19 right ventricle pressure without a cardiac pathology, and 54 was normal, were normal. Around surgical indications, 63 patients, this psychological discomfort of appearance, 11 dyspnea, and 3 chest pain, 1 pulmonary recurrent infections, and 4 palpitations. And Heller index is higher than 3.25, 37 patients. And 63 patients discomfort of appearance. All pulmonary function tests were normal, but echocardiography is 23 patients, 7 mitral valve prolapses, 1 Epstein anomaly, 15 right ventricle pressure, and we performed tissue Doppler ultrasonography and measured the myocardial perfusion index. And 11 dyspnea, and the 4 is the right ventricle pressure is higher. And 37 patients, the Heller index is higher than 3.25. Echo findings and 12 patients, 3 mitral valve prolapses and 9 right ventricle pressure. And 2 patients at recurrence after the ravage procedure. And we performed the surgery of the NAS procedure with the video thoracoscopy, single bar and 1 side stabilizer routinely. And the single bar and double stabilizer with fixing PDS for severe deformities. For 1 patient's double bar, we use it, but one bar was rotated. And we use the medical air insufflations via thoracar to dissect the anterior mediastinum. It's beneficial for the dissections of the mediastinum. Combined surgery we performed for 1 case with congenital cystic adenomatoid malformation. The first left lower lobectomy with a minimal invasive procedure and 1 port and non-spirit utility thoracotomy. and then we inserted one bar and two stabilizer. No needs the chest tube, aspirate the intrathoracic air to expand the lungs. Complications, 1 migrations and revision, 3 severe patients, if an early period, first hospitalization and late oral analgesics, 3 bar exit from skin, and bar removed the postoperative 4th and 5th and 6th months. 1 wound infections, and then intravenous antibiotics applied. Postoperative period, hospitalization time nearly 4 days, and bar removal time 27.18 months. And we bar removed from the 54 patients with pectus excavatum. Postoperative period, we evaluated the echocardiography and the corrections. They find out the corrections of the right ventricular pressure and pulmonary functions test, especially the effects of NAS procedure, the maximum inspiratory pressure and maximum expiratory pressure we measured. And the significant, good results from the postoperative period of NAS procedure. And the pectus carinatum, 33 patients, 30 males and 3 females. Operating age is 15.45 years old. And surgery, 2 Ravitch procedure and 31 Abramson procedure. And we applied 2 brace and 2 patients in the bracing, and 31 Abramson procedure to fix the bar. We use a steel wire around the rib bilateral. And 1 patient's simultaneous the surgery with the pectus carinatum and bar removal after the Abramson procedure, then thoracoscopic thoracal sympathectomy for the palmar sweating. Complications, 6 patients, 1 patient's bar removed 4th month and the others medical follow-up. And the skin reactions, the 3 patients, 1 cultures was negative, and bar removal time the 4th, 7th, and 10th months. The bar removed the necessary, and it's not necessary because we take off the stabilizer and one side the bending. If the bar fixed it, there is no problem. Postoperative hospitalization time is 4.15 days. Bar removal time is 16 months approximately. This is the turning point when we encountered the minimal invasive repair of pectus deformity. After NAS, the complication rates gets lower. Excellent exposure to dissect the mediastinum if they're using the medical ear insufflations. The most important part were dislocations in our series. It's a preventable stronger fixation and using the stabilizer. Thank you so much for your attendance, please.